So news that South Africa has temporarily halted its vaccine rollout has, of course, also made global headlines. The variant discovered here in December seems able to evade the vaccine's immunity. That small study with young people found 22% efficacy in preventing mild to moderate illness. We don't yet know if it prevents serious illness, because the study has not been done on humans as yet. But millions of people in Britain have already received the AstraZeneca jab. So what does this mean for the United Kingdom? Our correspondent Ollie Barrett joins us now. So hi Ollie, always great to chat. How has the South African news been received by health specialists and scientists in the UK?
Hi Sally, I think the main priority for officials in government and the scientists advising them today is to try and reassure the British public after the news that's come out of South Africa that the Oxford AstraZeneca jab is safe and is effective and is well worth continuing with the rollout of. We've been hearing from Prime Minister Boris Johnson today. He says that all of the vaccines currently in use in the UK, and that is only 2 at the moment, the Pfizer jab and the AstraZeneca jab, do offer protection, he says, against serious illness, hospitalisation and deaths when it comes to COVID-19. And we've heard similar from other scientific advisors and ministers too. One of the health ministers earlier today, Edward Argar, was saying that there's no evidence, actually, when you look at the AstraZeneca vaccine, that it doesn't offer strong protection against serious illness, hospitalisations and deaths, even when you look at the South African discovered variant. Clearly, though, officials here also want there to be more data on all of this so people can be perhaps more sure even than they are at the moment. But other officials are pointing out that when you look at the tens of thousands of people who've been involved in trials of the Oxford AstraZeneca jab all around the world, not a single one, according to any of the trial data that's been published, have been hospitalised or died. So certainly an effort underway here to try and reassure the British public, as I say, and we will hear a Downing Street press conference coming up in the next 45 minutes or so from the Health Secretary Matt Hancock, and crucially the Deputy Chief Medical Officer for England, Jonathan Van Tam. The reason I say that that is crucial is that he's considered one of the very best communicators in the British government when it comes to these scientific advisors. So I expect that is why he's being rolled out today.
It's really interesting, Ollie, because the reality is the science is changing and developing every single day, and at the same time it has to be communicated to a very anxious public. We know that AstraZeneca, the Oxford trial people, they're working on updates already that will deal with the variants discovered in Britain and also in South Africa. And it sounds to me like this is probably going to be an ongoing process as the vaccine mutates. So the scientists will have to chase it and try and develop a booster that will deal with that.
Absolutely right, and we've heard exactly that from the Vaccines Minister, Nadeem Zahawi, today, saying that he believes it will become a bit like the situation you have with the flu jab in this country and others, where you do get those annual boosters which are developed and changed according to the shape of the virus that they are trying to defeat. We also heard from the Oxford team as well some pretty rapid responses once the study came out with regards to the South African discovered variant, and they were very honest, saying, look, it may well be that this vaccine, when it comes to some variants, it doesn't stop the virus in its tracks, but what it does do is avoid people having to go to hospital or falling seriously ill and sadly dying at the end of that infection period. And the Oxford team making no bones about this, that they still think that will be a pretty good outcome. If you do take away the hospitalisations and the fatalities, even if cases continue and the virus continues to spread, that's certainly a better place than we're in now.
In the meantime, Ollie, while they work on new versions of the vaccine to deal with these new variants, what does it mean for South Africa? You were explaining to me last week that South Africans are banned from entry into the UK. If you come from a hotspot area, you won't get into the UK, even if you're prepared to quarantine at a hotel at your own expense for 10 days. Do you think the concern around, and the latest news coming from South Africa around the human trials on AstraZeneca, that is not as effective as we'd hoped, do you think that's likely to make the UK even more reluctant to let South Africans in?
Well, not just South Africans, other countries around the world in which variants like this are thought to be potentially spreading. And certainly it has today increased the political pressure on the government here. We have, as you say, on February the 15th, this policy of hotel quarantine coming in for UK residents who might be coming from some of those so-called red-listed countries where variants are thought to be spreading more quickly than some of the earlier versions of coronavirus. But the opposition Labour Party is saying, look at this study with regards to the South African discovered variant. That shows that we should be even more vigilant, that actually borders should be completely closed at this point to international travellers. So it's certainly intensified that debate. And then you look a few weeks or months ahead of all of this, and people in this country are already starting to talk about summer holidays and whether there might be some countries that people will be allowed to travel to and from if they've been vaccinated and if there are low levels of infection in those destination countries. All of those considerations and discussions are really intensifying and have certainly become even more live, given what we've now heard about the potential efficacy implications with regards to the South African discovered variant.
Thank you very much. That's our correspondent from London, Ollie Barrett.